You'll get 1 minute to read the question. Right, so if you have read and understood, considering it communication skills station, kindly begin. Please begin.
Okay, thank you. Hello, good day. I'm Dr.
Yes.
Kamadun Ibrahim, one of the surgical team. Please,
Yes.
may I confirm your name, please?
In relation to the child.
I'm Mrs.
Mother
Jennifer,
Yeah,
mother of my
Ex,
girl,
yeah.
Fatiha, 10 years old.
Oh,
She's 10 years old.
okay, please. How would you like me to address you, please?
Sorry, please again.
How would you like me to address you?
I'm Mrs. Jennifer.
Okay, Mrs. Jennifer. Nice meeting you. Sorry, we could not get your permission before we send to your child. You might ask, can you tell me what you know so far about your child, please, about your daughter?
I was at work actually, and I just had a call that my daughter fell sick at her school, and she's brought here in the hospital. And now I came here to know the details.
Okay, Mrs. Jennifer, I can see you're anxious right now. Can you please sit down, please?
Yes,
Are you
okay.
Are you comfortable?
Yes.
Okay, so I'll be telling you everything you would like to know about your daughter. Would you like anyone to be with you, or you're okay at the moment?
I'm okay now.
Okay, Mrs. Jennifer. Just a few hours ago, your daughter was rushed in by a school teacher to our hospital, and from our assessments, we find out that she has what we call acute appendicitis, and that's just an infection of part of the organ in the tummy called appendix. Is located just right here in the lower part of the right tummy. So at the moment, we are making effort to have her do 1 or 2 investigations and to work her up for operation.
Okay.
Do you understand
what
that,
do you
ma'am?
think? What happened actually?
What did you say, Mrs. Jennifer?
What do you think now? What happened actually to my daughter?
Yes, we think it's appendix from
Okay, are you sure?
presenting from our complaint, and from our complaint and from the examination that we've run on her, is typically looks is suspicious of what is called acute appendicitis. But we won't be 100% sure until we probably go in to have a look at it.
So you're not sure? What did you say just?
Yes, all we can tell you now is that everything she presented with is suspicious of it. It's a common condition, especially around this age group, something they do have. And once we see it, there are things we look out for. And once those things are there, we can almost say that is acute appendicitis. So we want her to do ultrasound of the tummy as well, which could also give some guide to possibility of acute appendicitis.
Okay.
Yes, ma'am.
Now, what to do for this?
Yeah, so what we are planning to do now, our consultant is on his way. Will soon be here so that we can move her to the theater and we can quickly have a look at the tummy and remove the appendix.
Okay. Is it dangerous? I'm really anxious.
I can understand your apprehension. Acute appendicitis is it can be life-threatening actually, but since we able to pick it early and we can quickly go in, we can remove it, and this will save us from untoward complications. That's the afterwards effect of it. And since it's coming early, and from look, it looks like it's not ruptured, so we might just be we may just have to have a small cut in the lower part, the right side of the lower tummy, for us to get access to where it's located. Then we can remove it. So we're just going to live with just a small scar afterwards.
Is there any other possibility that it's not appendicitis? Any other anything else?
Like I said earlier, there are possibilities. However, this could only be ascertained by the time we go in to have a look. So this appendix will remove it, and something else we could also go ahead and take care of it. And if there's need for us to extend our cords, our incision in the tummy, we have to do that for us to have more space. But you can be rest assured that your daughter is going to be operated on by one of the most competent surgeons in this hospital, and I'm sure the best will be done for her.
Okay. Who will be the surgeon? Are you going to operate?
You said what?
Sorry?
Hello? What
Yes.
did you say?
Can you hear me?
Yes, I can hear you now.
I said who will be who are going to operate? Are you the surgeon?
No, I'm not the surgeon. It's one of my senior colleague consultants, Mr. Ladd. I'm sure he will be around by now. He's the one that's going to lead the surgery.
Okay. Is the operation necessary? There is no other way out?
Yes, it is necessary because usually children they have less fat, and if it's not done early, it could actually rupture, and this could be dangerous to our life. There could be other ways. We could give her antibiotics, but however, this may probably not be enough. We may still have the same complaint later on. So it's better we'll take it out now. Leaving it to a later, it may actually be dangerous because by then it may actually rupture. And now that you can still pick it early, will be a better time to operate on her.
Okay. Is the wound going to be disfiguring?
Not as such. As I said earlier, just going to be a small scar. Since it's not ruptured yet, it's just going to be a small incision at the lower parts of the right tongue. And at the end of this day, you're just going to leave her with a small scar around that area.
Tell about other risks with this appendix. Yes. Mention about the other risks which are associated with appendectomy, infection, and can block.
Yes, sir. There's no operation without risk, and One of the risks that could occur with this is infection following the surgery. One of the infection could be fertile because on the right side he has the right fallopian tube that carries egg in female, and it could actually be blocked, and this could cause subfertility in her. However, not to worry, she has the left fallopian tube will be pitted, and this will be no cause for alarm. But of course, not that we see this in all patients, but it's important to we'll let you know about it.
Okay, close the consultation.
Okay.
How would you close it now?
Okay, so Mrs. Jennifer, I've discussed with you about your child. I've told you that you present with complaints that is suspicious of acute appendicitis. Finally, we are working her up for surgery, for operation, and my consultant, Mr. Lad, will be getting ready to operate on her now. I'll explain to you the likely complications. So we are always here to support you in case you still need any question for me. I'll be dropping my phone number with the nurses, so you can reach out to them. You can call me to get across to you. Do you have any other thing you'd like me to address, please?
No, thanks.
Okay, thank
so
you.
much,
What was this station was about? What was the aim?
Station.
Yes, but what was the aim or the goal of the station? What you had to do as a surgeon, as a candidate during the exam? You had to take the consent, even when patient was already in OT, in induction. So all the purpose of telling all this information was because the mother is the guardian. Father has been died, because here the person who was helping you was just helping you, for not prepared for the exam. But if in exam the actor, the mother, will be very much prepared, and the question or the discussion will be that no, not Dr. Ladd, because Dr. Ladd operated on my husband and he killed my husband, and then you'll discuss and you'll find out that husband had stomach cancer or something, and the husband died actually because of the cancer, not because of the surgeon Ladd. So that discussion should also be done, or should also be carried out. It wasn't carried out, and then I had to prompt you to tell the risks because she was asking. Mother was asking, is there any? Is it important? Is there any other way around? What would be the risks? Basically, this is what mother was wanting you to tell, that there could be. But then you told afterwards, not at that particular time, but you did. So all these, and at the end, you'll close your consultation and you'll make the mother to sign the consent form.
Okay, ma'am. Thank you so much, ma'am.
Thank you. So that is the basic aim of the whole communication, that you are communicating it. Mother is very furious. Okay, you asked in the beginning if it's all right. Do you need someone beside you, and you can maybe offer the chair. You can maybe ask, because mother will be crying, will be very too much. Not angry, but too much feeling guilty,
Aggressive.
and not aggressive, in a, like too much feeling guilty, and too much I'm not finding the exact word. Anyway, she will be very much frustrated and irritated, and then she'll be complaining a lot and accusing herself a lot and crying a lot and talking a lot. And then you would have to make her sit down, and you can offer her the chair, you can offer her the glass of water, you can ask her, because she'll be crying, so you can offer her tissue paper so that she can stop crying. Yeah. And then you can ask, is that all right? Or do you need someone to be with you before I tell you? Then all these reassuring talks, and then you'll tell about who will be operating on the child, and she'll again start the same hysteric events, that no, not Dr. Ladd, he killed my husband, etc. So that's That's the whole scenario.
Yes, ma'am.
Basically, you have to take the
Yes, ma'am.
consent. All right, good. Thank you.
Thank you, ma'am.